More COVID vaccines will be available in the next few weeks and months, and community groups are figuring out how they'll make sure their members are ready for these shots.
We already told you more than half of Ohio's nursing home staff is turning down that vaccine because they just don't trust it.
Our Kevin Berry explains how Cleveland's Black community is trying to make sure the same thing doesn't happen with them in this News 5 original.
In the midst of a global pandemic, Dr. Laulu Fayanju says he's finding a chance to build trust.
It's an opportunity for us to really try to change the course of how minority communities perceive the healthcare institutions and healthcare providers.
History has given minority groups, specifically African Americans, plenty of reasons to be skeptical. Medical experiments on that population date back to colonial times, but the Tuskegee syphilis study might be the most well-known. Nearly 400 black men with syphilis went untreated for 40 years without their consent so doctors could study the disease. Dr. Fayanju says he's often pushing back on patients who are skeptical of modern medicine, like the COVID vaccine, because of what medical professionals did to black people in the past.
It would be a double tragedy if we did not make sure that these communities had good access to the vaccine that can save lives and can prevent more death and more tragedies.
It's especially important now because the coronavirus has hit minority communities so hard. The CDC says black people are almost 4 times more likely to be hospitalized with COVID compared to their white counterparts, and almost 3 times more likely to die from it.
Kids sell toys to kids, adults send messages to adults.
That's why the Cleveland NAACP president Danielle Sidnor says the messenger is so important. She's lining up black doctors who can eventually talk to the black population, convincing them to get the vaccine. But to do more, she says money from the state could go a long way.
Oftentimes what's asked of us is to champion and do 75% of the work, but it takes resources for us to do that adequately.
She says her organization is already talking to state leaders about getting financial help for an even bigger outreach campaign based on its established Get Out the Vote and census efforts.
So we already have, networks, and we have strategies that we've deployed for those types of efforts that we will now just change the messaging of what we're talking to community about.
That message will encourage people to get vaccinated. And while Americans have hard conversations about racial equity in all parts of our lives, Dr. Fayanju says showing that the COVID vaccine is safe and effective for the black community matters.
I think we can turn a page here, and I think even in the midst of this tragedy, we can make a huge difference.
In Cleveland, I'm Kevin Berry, News 5.